parler du cancer.
Thank you very much for this opportunity to tell you about the MSF cancer project in Mali. Now, just taking a look at the map of the world, I'm afraid it's not the slide I'd like to see now. I'd like to see the map of the world. Thank you. No, sorry for that. So looking at the data produced by the International Research Center on Cancer, cancer appears as being a major burden. However, in low and medium-income countries, and more particularly in sub-Saharan Africa, the incidence doesn't look to be very high. However, it needs to be qualified. Firstly, because there is a lack of access to care. So if you don't get patients in the health centers, you don't see the cases, and there are also no registries. And more worryingly, we know that the cancer cases are going to double in the 20 next years in sub-Saharan Africa, in countries that are not ready to tackle this increase. And there are other sources of inequality. You can see that in terms of mortality, it's quite striking. The incidence and mortality is really very different from what you see in the global north. Now, to efficiently control or prevent cancer and cure cancer, you need to focus on the various stages, because you can't treat cancer if you do not have a proper diagnostic, and this confirmed by histopathology. And now, let me give you two striking examples of lack of access in these countries. Firstly, the cervical cancer, and you can see that it's quite high. The incidence is high in sub-Saharan Africa, and it does dovetail the lack of HPV vaccination and also radiotherapy. You can see that there's a lack of equipment. So, of course, we can do more chemo, we can do more surgery. However, if there's no radiotherapy available, you're stuck. It's a bottleneck. Now, there's some general movement and awareness with healthcare workers, international organizations, but not enough is done to help patients. This is why MSF has decided to participate in a Malawi project on cervical cancer and another project in Mali for cervical cancer and breast cancer. And Marie-Hortense is going to tell you about this now.
Merci, Claire.
Thank you very much, Claire. Now, here's our oncology project in Mali. So, what's the situation in Mali? The estimated population is 20 million inhabitants, and the incidence is 140 per 100,000. The number of cancer cases in Mali, all genders and all types taken together, is estimated at 14,185 in 2020. Women are more affected with a very high mortality rate. Breast and cervical cancers and uterus cervical cancers are the most frequent ones, and they account for 31% of cancers and approximately half of cancers in women. Before our project, assessment had been performed by MSF team, and this gave us the lay of the land with regard to cancer management in Mali. And it was observed that the mortality is very high in women with cancer. Indeed, there are some referral structures. However, everything is in Bamako, and in fact, there are specialized doctors, but not enough. And with regard to the patient's pathway, it's really very difficult. Not all departments, not all units are in the same hospital, and the financial cost is very high and beyond the reach of a majority of patients, more particularly when it comes to drugs and imaging. And there are also there's also a lack of information on the pathology itself, and there are also some beliefs that prevent people from consulting early enough. So much so that when these cancer cases are diagnosed, it's usually very late, and the chances of having a cure or a remission is very limited. Now, there's a political will to fight against this, and there's indeed some budget for buying chemotherapy drugs, though it's not enough. But it explains why we decided to open this project on oncology in Mali. So what are the objectives? Now, this is a project that was developed in partnership with the MOH with 5 major objectives: to strengthen the early screening, also improve the management for cervical and breast cancer patients, and make support and palliative care available for all cancers, also ensure coordination and support for patients, and also make sure that there's access to different tools for diagnosis and for treatment for clinicians, for health workers in Mali, and possibly at a later stage in Western Africa. Now, alongside these specific objectives, we also have a list of support and cross-sectional thrusts or axes with logistic support, because, of course, we know that cytotoxic waste is going to be generated. We need also to have equipment, maintenance for this equipment, improvement, making sure that the working conditions are safe for the personnel, and then, of course, training and partnership with another institution, and finally, operational research and innovation. Now, let me tell you about the implementation in the field. The palliative care was the first objective to be rolled out when we opened the project at the end of 2018. So all patients benefit from support in palliative care, and it's free of charge. The clinics for palliative care, both in clinics and on an outpatient basis, include pain management and management of other symptoms, psychosocial counseling for the patient and their families, also wound management, and with the help of remote support from Institut Curie, also home visits. Now, I want to warn you that the next slide might be a bit shocking. However, we wanted to share it with you, because you see, this is what happens. This is the sort of tumor wound care we are faced with at MSF, and also how much these cases have progressed, and moreover, how a proper dressing can help these people who are stigmatized, who are ostracized, who are excluded from social life, because usually these wounds are quite ghastly to look at and smelly as well. Now, the second objective, i.e. management of cancer, it's to do with the management of breast and cervical cancer with drugs provided by MSF, surgery with kits that are paid for by MSF, and radiotherapy. Unfortunately, radiotherapy is very difficult. The only machine that is available in the country is very often out of order. So currently, MSF teams are working on specifications to support the purchase of another machine for radiotherapy. MSF also covers the cost of extension of staging assessment and make sure that the multidisciplinary meeting is held before any onset of treatment. Early detection is the third objective to be implemented, as was implemented as of March 2020.
Routine et des campagnes du programme national des
reinforcing the routine campaigns of the existing program, systematic palpating of the breast, paying for imaging and microbiopsy. And we will get more involved in the coming months by expanding screening possibilities all over the city of Bamako and even in other regions. When it comes to the quality of diagnosis and reducing the time it takes to give the results, we worked to upgrade the only anatomopathology laboratory, and MSF will provide support with training and HR. Sensitizing the local community and informing the local stakeholders, whether doctors, traditional healers, or NGOs, is necessary to know the disease better, to facilitate transferring and the adoption of best practices. We have to focus on coordinating healthcare and providing support, accompanying the patients. Providing support to the patients is essential to ensure the continuity and the success of the treatment. So we will set up a liaison unit and cancerology support unit so we can really focus on the patient, provide more social support, and facilitate the links between the several people working around the patients. It will also be a place for counseling and information. Some data of the project we carried out in 2020. This project, over 10 months, participated in the screening of the cervix and breast cancer in 49,000 women. Healthcare was provided free of care to 542 patients. 100 had a full chemotherapy treatment and some 30 had surgery. The patients we treated are pretty young in majority compared to what we see in Europe. Nearly half of them were below the age of 45 years old. 500 home visits were done by our teams for 184 patients, and an average of 235 patients a month had a support, counseling, and palliative care. Finally, I will hand back to Dr. Claire. She will tell you about the various challenges and stakes that are related to an oncology project. Yes, as Marie-Hortense told you, we are faced with numerous challenges. The first one, and the major one, being that this type of project should lead us to work in a different way. First, in terms of duration, we have to protect ourselves on the long term, 10 years being a minimum period of time to embark in oncology. Then we should have a patient approach focused on her medical needs, social needs, and the whole environment of the patients. That's key, or her. rather, women. Those are cancer healthcare is highly specialized, and you have to be really close to the population. Awareness growing. You have to go out of the hospital to do outreach. You cannot work on your own. You have to work in a real, well-balanced partnership and in a network, whether it be with international experts, but also with the local health professionals, doctors, and health authorities. Also, we have to get more involved in teaching, not only for MSF staff, but also for the local health professionals. And last but not least, we should really initiate a data collection scheme adapted to those situations. In order to do more research, it's essential. My last slide, please, or one before last. For our research activities, we need to follow up cohorts. And today, we don't know how to get the right follow-up. We don't know how to evaluate the patients we follow up, and what are the outcome factors, prognosis factors. Secondly, we need to evaluate some healthcare models that are widely used in Europe, but not so much in Africa. Decentralized healthcare, like home healthcare, or the evaluation of the patient journey. Those patients have to consult with many different specialists in different locations. It needs to be coordinated. MSF also has a role to play when it comes to introducing and evaluating new technological tools. They're booming right now. There's a real surge in the use of high-tech tools like artificial intelligence. Will never have enough radiologists to read all the mammographies in one country. We could be helped with that. There is an ongoing project with the Foundation for the screening of cervix cancer and teleradiology and the rest. Research is essential. There are big topics to be addressed. For cervix cancer, we do radiotherapy surgery, very little radiotherapy, but in countries where we cannot have access to radiotherapy, it might be a good idea as a first-line treatment, but it's not assessed enough. Marie-Hortense showed you those big wounds. We have an ongoing project with the Curie Institute with dressings, with cinnamon. It's very useful, particularly to combat odors. And then is there recruitment bias? We're looking at our recruitment. Also, access to treatment, sure, but access to all the various stages in a cancer. We have to prioritize. There is so much to be done. But the first example would be HPV vaccination, then trastuzumab, monoclonal antibody against breast cancer, genetic therapy, radiotherapy, maintenance, and the rest of it. And finally, I'd like to thank all the MSF teams that have been working in those projects for years. The headquarters are also are helping us. All our health professionals of the MOH in Mali and Malawi, and all the international experts who help us pro bono to conduct and build those projects. Many thanks to all.